Hi everyone, my name is Darcy Johnson. My group members are Jessica McAndrews, Mariah Townsell, Kristen McElroy, and Shannon Henderson. The assigned topic for our group was Ellison Preschool. Ellison is an inclusive urban school serving 150 special education students ages 3 to 5. Many of the students at Ellison are nonverbal, and a few of these students utilize the PEC system, which is Picture Exchange Communication, and that's their form of communication. So tantrum behavior was identified as the most prevalent behavior in each of the classrooms at Ellison. And tantrums are most often occurring when students are playing and taking items from one another. We have chosen to implement functional communication in place of the tantrum behavior so that the students can appropriately request an item or request to play with a friend. So functional communication training is an effective replacement behavior for individuals engaging in these tantrums. We operationally defined a tantrum as an unwanted behavior in which the individual engages in screaming, crying, physical aggression, or self-injurious behaviors to gain a preferred item. So problematic behaviors such as this must be replaced with what we call socially significant behaviors. A socially significant behavior is one that is useful and beneficial to the individual as well as to others and would avoid anyone from getting hurt. So functional communication training has been developed to help individuals request something they want or need, or also as a way to explain themselves. In our case, it would be to explain something that they want. So the phrases that are going to replace the inappropriate behavior have to serve the same purpose and function as the problem behavior. And next, Kristen will explain how to implement the FCT.
Hi, I'm Kristen McElroy, and I'm going to explain how you implement FCT. As described by Darcy, the FCT is functional communication training, which is used to replace, in this case, tantruming behavior with varying methods of communication. Our function has been determined for the tantruming behavior. And after the function is determined, we need to figure out which method of communication works best for the child. And this may take some trial and error to figure out how the child communicates. It is important that if the child is nonverbal, you will want to try their device if they have one available. PECS, as mentioned earlier, and which stands for Picture Exchange Communication System, or sign language. If the child is verbal, you will want to try teaching them 1 to 2 word phrases. It is important that you teach the child the verbal words, the name of the person, the picture, the sign, or the location of the icon on their device before you really dig into FCT. Once you feel confident that they understand the material, then you can move on. Checking for knowledge is crucial for this. You want to begin using the methods, the communication methods around the environment, which could be in the home or the classroom. In this case, it'll be the classroom. This will require one-on-one or a group no bigger than 3. And you'll want to do most to least prompting at first, hand over hand, and create opportunities for the child to utilize the material and reinforce immediately after the child has done a correct response. And that is how to implement FCT.
I'm going to talk to you really brief modeling strategy. So if you in order to teach them a more appropriate or more socially acceptable way of communicating what they want. So at first this is going to be airless or hand over hand, or some other type of prompting to make sure that you're prompting the correct response. And hopefully eventually they will catch on and learn that correct response. And then you want to teach them different phrases based on their communication system. So if they do have a PEX, or if they do have another communication device, have those different responses loaded in so that they're easily available to select, essentially. If possible, what you can also do is create a video model. So something that's going to show visually, what the expected behavior is, and then what happens when that expected behavior occurs. So you would have two teachers essentially modeling a typical situation where a child has a toy and then a child takes the toy away, and how to properly respond to that situation. And now I'm going to talk to you a little bit about how it addresses our scenario. So what it's going to do is teach our students how to ask for things, and how to be calm when things are taken away from them. These are just simple life skills that will help them in the long run. So if we can teach them how to communicate through their words or through their communication system, they will not have to engage in any type of harmful behaviors to themselves or others. And we can also attempt to teach other skills to kind of piggyback off of those communication skills. So as far as tantruming, it's going to teach our children to decrease the amount of tantruming and increase the amount of communication going on, so that the person that they're speaking to knows exactly what they want and they get exactly what they want, and that tantrum behavior goes down.
I'm Shannon Henderson. I'll be going over the overview of the school-wide implementation plan. Ellison has 20 classroom teachers, 40 teacher assistants, parent volunteers, 2 speech therapists, 1 occupational therapist, a BCBA, and a principal who work within the building. Ellison currently is having behavioral difficulties during playtime in the classroom, as we talked about before. In order to reduce this problem, we will be implementing FCT as a Tier 1 intervention, as all the students will participate in order to improve communication skills and reduce the problem behavior. However, depending on the student's needs, it could be tailored to serve as a Tier 2 or Tier 3 for students who need more individualized support. FCT works to identify the function of the problem behavior, and it teaches an appropriate communication skill that serves the same function as the problem behavior. The plan is to spend the first 6 weeks setting the stage for the implementation, and then the next 6 weeks we will be implementing it in 5 different classrooms, and then the last 12 weeks it will be implemented across all classrooms and students. Ellison not only has the capacity to implement FCT, but they also have funding through IDA Part B grants, and they also have the resources through the individuals they already have on staff. And next we'll have Jessica talking about the final tips.
Hi, I'm Jessica McAndrews, and I'm going to go over the final tips for our presentation. Functional communication training gives students the opportunity to communicate what it is that they want or need without needing to engage in problem behaviors. This intervention is research-based and has been shown to be highly effective for reducing or extinguishing problem behavior. The key to functional communication training is knowing what function the problem behavior serves. Making sure that the problem behavior no longer serves the function it once did will make the intervention more successful. It may help to remember that the problem behavior is a habit to the person engaging in it, and to be patient, but continue teaching the new behavior while not allowing the old behavior to serve the same function. Be sure to reinforce quickly and frequently as the intervention is first being introduced. This will help the student to want to engage in the new behavior over the old behavior. Overall, functional communication training gives the learner a necessary life skill in learning to more effectively communicate. And that is it for our presentation.